Hello, and how are you? Welcome to this class where we'll be focusing on health planning challenges. And if you're new here, kindly remember to subscribe, share the video with your friends, and welcome other people to be part of our family at Medic Academy. So, the challenges in health planning are quite diverse, and most of the time they are a bit organizational or also systemic. So we will discuss a few of them, and let's start with the macroeconomic instability. Here we are looking at changes in economy that sometimes affect the health planning process. With macroeconomic instability, there's changes such as inflation rates that affect the budgets and affect the resource-wise that is supposed to be allocated for the different activities or plans that the department or the committee could have looked at. So the biggest risk here is all about inflation, but you have to also appreciate that other economic changes can affect the systems or can affect the plans that the health planning committee could be working on. The other bit is poor financial information, whereby the committee could be having lack quality or timely financial information, and this could be on issues like donor funding, budget allocation, governmental allocation, and policies in regards to planning and budgeting. So when it comes to health planning, the challenges stem all round, but as a responsibility to the committee, they need to work around on how to ensure that there's a balance in terms of what should we know before we go ahead and plan in terms of financial information, the source of funding, donor funds, help, and all sorts of funding that the committee uses. The other aspect is the weak financial systems, whereby due to poor budget ceiling adherence, they come up with maybe haphazard budgets that do not make sense or do not prioritize the key areas that needs to be catered for while you're coming with the health plans. And the last part here is the poor prioritization. So with poor prioritization, it's appreciated that sometimes there's institutional weaknesses when it comes to bringing in priority programs. So you find like maybe you're working on these maternal health plans and intervention activities that you wish to reduce maybe mortality rates. But again, there could be poor research that has been done on the needs that are existing in the system, and then people develop poor activities that are not well prioritized. Then lack of budgetary discipline, for example, supplementary allocations being made during the year. It's really absurd when a committee has sat down and developed all the possible budgets that can cover given interventions. And then before the financial year ends, there's an issue with supplementary allocations. Now, a supplementary budget is a budget that is made to cover for needs or to cover for resources that were not yet allocated during the beginning of the period. So with such lack of budgetary discipline, sometimes it increases the budget allocations for some of these projects. So it's good to have budget discipline so that whatever the committee decides or comes up with as part of the plan and the resource or costing that is needed for the particular year, there will be need for supplementations. Otherwise, with increase in supplemented budgets, this leads to increase in cost. It leads to increase or bulging resources that may not be able to be catered for adequately. And then we have the over and under projections. Looking at the process of planning or the cycle of planning, there are those stage where you have to do costing and budgeting. Now, the costing and budgeting has to be guided with research backup so that you have evidence-based budgeting, and that whatever you come up with is in order of what is priority or in order of what is there in realistically, so that what you budget for makes sense, so that you prevent all this over or under budgeting. So with cases where there's overestimation of revenue sources, sometimes we end up becoming unrealistic in what we are budgeting in the programs. So this now most of the time leads to cases whereby you have an over budgeted plan, but again there are no resources on the ground. And what happens is now is where government starts to either borrow loans from other sources to cater for these programs, and this increases the bill for the different economies or the different country governments that exist. Right. So thank you so much for staying with us to the end. And this is the type of content that you really enjoy. Remember to subscribe and comment. Thank you and see you in our next class.